Speak a prosody rate 100%. Which class of antidepressants is considered first-line therapy for major depressive disorder due to favorable safety and tolerability? Selected serotonin reuptake inhibitors, SSRIs. Remember, SSRIs equals safe serotonin rescue. Name the SSRI with the longest half-life, that therefore has the lowest risk of discontinuation syndrome. Fluoxetine. Remember, fluo floats for days. Which life-threatening adverse effect results from combined use of MAO inhibitors and SSRIs? Serotonin syndrome. Remember, too much 5-HT sparks storm. Which reversible inhibitor of MAOA is commonly used for atypical depression in India? Moclobemide. Remember, mock the MAO briefly. Which tetracyclic antidepressant is notorious for causing appetite stimulation and weight gain, but is preferred in depressed patients with insomnia? Mirtazapine. Remember, Mirta makes meal mighty. Which TCA is most cardiotoxic in overdose due to strong sodium channel blockade? Amitriptyline. Remember, AMI treats the heart. What is the antidote of choice for TCA-induced cardiac arrhythmias and hypotension? Intravenous sodium bicarbonate on methylator, topic. Remember, B-card buys beats. Which atypical antidepressant is also used for smoking cessation therapy? Bupropion. Remember, Bupro banishes butts. Which SSRI is safest to use in patients with cardiac conduction defects because it prolongs QT the least? Sertraline. Remember, Sertra spares QT. Name the serotonin norepinephrine reuptake inhibitor, SNRI, that is FDA approved for neuropathic pain associated with diabetes. Speak, duloxetine, is easily the most accurate drug for sleep C. Remember, dual action dulo. Which MAO inhibitor requires dietary tyramine restriction to avoid hypertensive crisis? Speak, prosody rate 100%, phenelzine. Remember, phenol plus cheese equals crisis. Which antidepressant is preferred in post-myocardial infarction depression due to minimal CYP interaction and cardiac safety? Sertraline. Remember, Sertra suits scarred hearts. Speak, prosody rate 100. What unique adverse effect is associated with trazodone at high doses, particularly in males? Priapism? Remember, trazo equals trazens plus boner. Which SNRI has dose-dependent mechanism, at low doses acts like SSRI, and at higher doses adds noradrenergic blockade? Speak, a prosody rate 100%, venlafaxine, prosody. Remember, Venla adds vroom. Which antidepressant is commonly associated with sexual dysfunction and anorgasmia? Speak, fluoxetine and other SSRIs, infectious disease. Remember, fluo freezes fun. Which receptor blockade explains the dry mouth, constipation, and blurred vision seen with TCAs? Speak with prosody, rate 100%. Muscarinic, M1 receptor antagonism. Remember, TCA equals totally cholinergic antagonist. Which NaSSA, Noradrenergic and specific serotonergic antidepressant, lacks sexual side effects? Speak, prosody rate 100%, mirtazapine. Remember, mirta minus mischief. What washout period in weeks is recommended when switching from fluoxetine to an MAO inhibitor? 5 weeks. Remember, fluo 5-week farewell. Which antidepressant increases seizure risk at high doses and is thus avoided in bulimia nervosa? Bupropion. Remember, Bupro boosts bursts. Which SSRI is preferred in pregnancy due to lowest teratogenic risk and extensive safety data? Sertraline. Remember, Sirtra, safe for stork. Which TCA is predominantly used for nocturnal enuresis in children? Imipramine. Remember, IMI impounds incontinence. Speak prosody rate 100%. Which SSRI has the highest potential to cause QT prolongation at high doses? Prosody. Citalopram is a chemical product, antibiotic for easy release and safety. Remember, CETA stretches QT. Which antidepressant modulates melatonin MT1, MT2, and 5-HT2C receptors, useful for depression with sleep disturbances? Agomelatine. Remember, AGO tunes alarm clock. Which mood-elevating drug acts by increasing presynaptic release of norepinephrine and dopamine, and is classified as a psychostimulant, not first line for depression? Methylphenidate. Remember, Methy sparks mojo. Which dietary supplement when taken with SSRIs increases risk of serotonin syndrome due to MAO inhibition? In a speak, this St. John's wort Hypericum perforatum, in a speak. Remember, St. John stirs serotonin. Which antidepressant is uniquely classified as a serotonin modulator and stimulator, SMS, acting as 5-HT1A agonist and 5-HT3 antagonist? Speak prosody rate 100%, vortioxetine. Remember, vortex of serotonin. What is the minimum duration, in months, recommended for continuation of antidepressant therapy after first depressive episode remission? 6 months. Remember, 6 months stay steady. Which antidepressant can precipitate a switch to mania in bipolar patients and thus requires mood stabilizer cover? Any SSRI, most commonly fluoxetine. Remember, SSRI sparks sunny mania. Which TCA is least anticholinergic and hence safer in elderly patients? Nortriptyline. Remember, Nortrip equals nootropic block. Name the MAO-B selective irreversible inhibitor used for Parkinson disease but not as antidepressant. Selegiline. Remember, cell B stops shakes. Which opioid analgesic should be avoided with SSRIs because it is a potent serotonin reuptake inhibitor itself? Tramadol. Remember, tramadol tops 5-HT. Which SNRI needs blood pressure monitoring because it can cause dose-related hypertension? Venlafaxine. Remember, Venla raises vessels. Which antidepressant is most likely to worsen angle closure glaucoma due to anticholinergic effects? Imipramine and other TCAs. Remember, IMI increases eye pressure. Which CYP2D6 inhibitor SSRI can raise plasma levels of codeine's active metabolite by inhibiting its metabolism? Speak, porosity rate 100%, paroxetine. Remember, Paro Parks P450. Which antidepressant is administered as a transdermal patch to bypass first-pass metabolism and reduce tyramine interaction? Speak, porosity rate 100, selegiline, high-dose patch. Remember, Pachiseligil. Which analgesic can displace TCAs from protein binding and precipitate TCA toxicity when co-administered? Aspirin high dose or NSAIDs. Remember, ASA pushes AMI out. Name the SSRI approved for premature ejaculation due to delaying orgasm latency. Duloxetine. Remember, Dapper, delay, drop. Which antidepressant is preferred in adolescent depression because of superior evidence despite risk of increased suicidality monitoring? Fluoxetine. Remember, fluo favors freshers. Which antidepressant combination is strongly discouraged due to risk of serotonergic thunderstorm? Speak, SSRI plus MAO inhibitor. Remember, SSRI plus MAO equals monsoon. Name the atypical antidepressant that blocks NMDA receptors at low doses and shows rapid-acting effect for resistant depression when given intranasally. Speak, porosity rate 100%, esketamine. Remember, esket lifts in hours. Which TCA metabolite is responsible for the antidepressant action of amitriptyline after demethylation? Speak, porosity rate 100%, nortriptyline. Remember, ANI turns NOR to work. Which serotonin receptor subtype overstimulation causes mydriasis, hyperthermia, and clonus in serotonin syndrome? 5-HT2A receptor. Remember, 2A equals 2 active. What is the typical latency period in weeks before clinical antidepressant effect becomes apparent for SSRIs? Speak, 2 to 4 weeks. Remember, 2 to 4 till floor lifts. Which enzyme does St. John's wort induce, lowering efficacy of oral contraceptives when co-administered? CYP3A4. Remember, John Jolt's 3A4. Which antidepressant is available as an orodispersible film to improve adherence in geriatric patients? Speak, mirtazapine, ODT. Remember, Myrta melts mouth. Which antidepressant markedly lowers seizure threshold and is thus avoided in epileptics, besides bupropion? Clomipramine. Remember, clomiclic's convulsions. Which SSRI is preferred for obsessive-compulsive disorder at higher doses than for depression? Remember, fluvo fixes fixations. Which antidepressant is most suitable for PTSD-related nightmares due to alpha-1 blockade property? Prazosin, though not in AD classically, or mirtazapine. In AD's answer, mirtazapine. Remember, Myrta mutes monsters. Which antidepressant switches off 5-HT reuptake and blocks beta-1 receptors, making it unique for anxiety with tachycardia? Propranolol is beta blocker, but antidepressant-wise, none. Trick, there is no true AD with beta-1 block. Remember, no AD blocks beta. Which atypical antidepressant enhances GABA-A via alpha-2 delta subunit, but is classified as anticonvulsant used off-label in anxiety? Speak, prosody, rate 100, pregabalin, off-label, in prosody. Remember, pre-GAB calms panic. Which antidepressant raises prolactin the most due to dopamine blockade, though mainly an antipsychotic? Amisulpride, low dose for dysthymia. Remember, Amisol PRL surge. Which SSRI-SNRI's combination is avoided due to pharmacodynamic duplication and risk of hypertension? Sertraline plus venlafaxine. Avoid SSRI plus SNRI combos. Remember, double Certavina, no. Which antidepressant acts primarily as a selective norepinephrine reuptake inhibitor, NRI, also used for ADHD? Atomoxetine. Remember, atoms ain't nor only. Which intravenous NMDA antagonist shows rapid antidepressant effects, but limited by psychotomimetic adverse effects? Speak, prosody, rate, ketamine, racemic. Ketamine, racemic. Remember, K-trip lifts gloom fast. Which antidepressant is avoided with linezolid because linezolid is a reversible MAO inhibitor? SSRIs, risk of serotonin syndrome. Remember, LZD plus SSRI equals lightning. Which SSRI inhibits CYP2C19 the least and can be combined with clopidogrel safely? Escitalopram. Remember, SC easy on enzymes. What is the mechanism underlying orthostatic hypotension seen with MAO inhibitors? Speak, prosody, rate 100%, decreased peripheral NE stores and alpha receptor downregulation. Remember, MAO empties NOR tanks. Which TCA uniquely blocks serotonin reuptake stronger than NE and is gold standard for OCD? Clonipramine. Remember, clomiclaws OCD. Which antihistamine property explains the sedation produced by low-dose doxepin used for insomnia? Speak, H1 receptor blockade. Remember, dox Z via H1. Which antidepressant causes minimal weight gain, is activating, and boosts energy, making it useful in atypical depression with hypersomnia? Bupropion. Remember, Bupro boosts battery. Which enzyme metabolizes most TCAs and shows genetic polymorphism leading to variable plasma levels? CYP2D6. Remember, 2D6 decides dice. Name the first FDA-approved digital pill formulation of an antidepressant for adherence tracking. Speak, prosody, rate 100%. Remember, Aripy ping pills. Which antidepressant may cause hyponatremia via SIADH, especially in elderly females? SSRIs, particularly paroxetine. Remember, SSRIs soak sodium. Which antidepressant requires baseline ECG when dose equals 40 mg day due to torsade risk? Speak, prosody, rate 100%. Citalopram. Remember, CETA needs cardio chart. Which herbal preparation used for depression is contraindicated with warfarin due to CYP induction lowering INR? St. John's wort. Remember, John jinxes Jantivin. Which antidepressant has active metabolite desmethylvenlafaxine marketed separately? Speak, prosody, rate 100%, venlafaxine, metabolite equals desvenlafaxine. Remember, vena seeds desvena. Which endocrine test must be monitored with long-term paroxetine due to risk of galactorrhea? Serum prolactin, 100%. Remember, Paro lifts prolactin. What is the mechanism of action of vilazodone classified as SPARI? Serotonin partial agonist reuptake inhibitor, 5-HT1A partial agonist, plus SSRI. Remember, Vila equals SSRI plus smidge. Which antidepressant is helpful in hot flashes of menopause due to NE reuptake inhibition? Venlafaxine. Remember, vena vents vapors. Which TCA is preferred for chronic neuropathic pain at doses lower than for depression? Amitriptyline. Remember, Ami aches, answer. Which antidepressant carries FDA black box warning for severe hepatotoxicity and thus requires monitoring of liver enzymes? Nefazodone. Remember, Nefa knocks liver. Which serotonin receptor antagonism explains mirtazopine's antiemetic property beneficial in chemotherapy patients? 5-HT3 receptor blockade. Remember, mirta blocks 3 motion. Which dual-action antidepressant inhibits norepinephrine reuptake and acts as alpha-1 antagonist, causing orthostasis? Trazodone. Remember, Trizodo equals trit and Z's. Which novel antidepressant potentiates AMPA receptor throughput downstream of NMDA inhibition? Speak of rate ketamine, esketamine. Remember, ket-AMPA kick. Which dietary amino acid should be avoided with MAO inhibitors to prevent hypertensive crisis? Speak, prosody, rate 100%. tyramine. Remember, tyramine plus MAO equals boom. Which SSRI is most potent? CYP2D6 inhibitor and may interact with tamoxifen therapy. Speak, prosody rate 100%, paroxetine. Remember, paro piles plasma. Which physical sign triad, clonus, hyperreflexia, hyperthermia, points towards serotonin syndrome diagnosis? SSE, key, label. Remember, hunter hunts 5-HT fire. Which benzodiazepine is safest for acute control of severe agitation and serotonin syndrome? Diazepam or lorazepam. Diazepam commonly used. Remember, Diaz douses 5-HT flames. What is the drug of choice for serotonin syndrome refractory to supportive care? Speak, prosody rate 100%. Cycloheptadine, 5-HT2 antagonist. Remember, Cipro cuts serotonin. Which antidepressant is least likely to cause sexual dysfunction, seizures, or weight gain and is thus called weight neutral? Speak, bupropion. Remember, Bupro body-friendly boost. Which TCA causes the maximum anticholinergic burden and is avoided in benign prostatic hyperplasia? Amitriptyline. Remember, AMI arrests A-flow. Which antidepressant's metabolite norfluoxetine has an elimination half-life of 7 to 15 days? Speak, fluoxetine. Remember, fluo lingers longest. Speak, prosody rate 100%. Which antidepressant can cause ankle edema in elderly due to vasodilation mediated by alpha-1 blockade? Prosody. Trazodone. Remember, TRA sock swelling. Which essential mineral's low level worsens SSRI-induced hyponatremia by potentiating Psi-ADH? Low sodium osmolality, but question aims at sodium. Answer, sodium. Remember, SSRI sinks salt. Which antidepressant is contraindicated with irreversible MAO-B inhibitors despite theoretical selectivity? All SSRIs, its risk remains. Remember, selective, still risky. Which serotonin syndrome precipitant is found in over-the-counter cough medicines? Which serotonin syndrome precipitant is found in over-the-counter cough medicines? Dextromethorphan. Remember, dextro equals 5-HT trouble. Which antidepressant is most suitable for elderly with polypharmacy due to minimal CYP interactions? Escitalopram. Remember, esky easy with every pill. Which SSRI has the strongest anticholinergic activity, making it more sedating than others? Paroxetine, paroxetine. Remember, paro packs pillows. Which antidepressant shows partial agonism at dopamine D2 receptors used as augmentation rather than monotherapy? Aripiprazole. Remember, ARI adds ARISE. Which SSRI is least likely to interact with warfarin metabolism via CYP2C9? Sertraline or escitalopram, except either, safest equals sertraline. Remember, Sertra spares INR. Name the serotonin antagonist and reuptake inhibitor, SARI, notorious for causing next-day grogginess at hypnotic dose. Trazodone. Remember, Traz is done next day. Which antidepressant rapidly normalizes appetite in cancer cachexia, independent of mood effects? Mirtazapine. Remember, Murta meals for mass. Which vitamin deficiency can mimic depression and must be ruled out before labeling treatment-resistant depression? Vitamin B12 deficiency. Remember, B12 blues. Which New Age digital therapy pairs low-dose fluoxetine with CBT delivered via smartphone for adolescent depression? Speak. Project Not Yet Drug. No official brand. Trick question. None. Frosity. Speak. Remember, APP alone, not a drug. Which antidepressant has a specific warning for interstitial lung disease and eosinophilic pneumonia, rare? Sertraline rare case reports. Remember, Sertra sometimes sniffs. Which TCA can be given intravenously for prophylaxis of chronic migraine when oral route not tolerated? Amitriptyline IV, rarely used off-label. Remember, AMI4, AIMS-H. Which antidepressants overdose presents with 3 Cs? Coma, convulsions, cardiotoxicity? TCAs, especially amitriptyline. Remember, TCA-CCC terror. Which SNRI is available as extended-release pellets that can be sprinkled on food for dysphagic patients? Speak of question, desvenlafaxine ER sprinkle capsules. Remember, Des Spry for spoon. Which antidepressant combo pill, fixed dose, pairs dextromethorphan with bupropion for treatment-resistant depression? Speak, prosody rate 100%. Auvelity, dextromethorphan, plus bupropion. And remember, AUV equals DM plus Bupro boost. Which low-dose TCA is used topically in pruritus because of H1 blocking property? Doxepin, cream. Remember, Dox cream douses itch.